Good morning, everyone.
Good morning, ma'am.
And please be seated. Thank you. So, I am John Amos P. Basorio, and I will be your competency-based trainer for today's session. And I am ready to facilitate our training session. Okay, welcome again to BT Care, Nail Care Services, and CP. So, before we officially start, I already check our facilities and our tools and equipments is already sanitized based on occupational safety and health procedures and also to training regulations of our qualification. And also I have here the attendance sheets. Kindly pass it to your co-trainer. Trainee. You sign it. Okay, thank you very much. And also I have here the learner's profile form. To kindly double check if the information about you is correct. And kindly affix your signature if your information all about you is correct. Please sign your Okay, thank you very much. And for next is the you're officially enrolled to BT Care, Nail Care Services, and C2. And also, before we officially start, again, here is the data gathering for me to know your profile and learning styles, and to know your prior knowledge and training needs. To help to answer, please answer this with honesty. Where is Okay, thank you very much. Again, here is the self-assessment check to evaluate your own prior learning. Here it is. Okay, thank you very much for your answering. Next is the pretest. This pretest is, you don't have to perfect this because this is just a diagnostic test to know your background knowledge about this training session. Okay, thank you very much. And the next one, the last one is the learning contract. To know, to ensure that your commitment in our training. Okay, thank you very much. And now let's start the orientation. So, of course, there is a house rules. So we didn't discuss this all because this is there is already there in the student handbook. The mission vision. Okay, the training approach, traditional versus CBT approach. Training approach in traditional education is teacher-centered, time-based, and focused on content delivery. then the competency-based training is learner-centered, self-paced, and focused on mastering specific workplace applicable skills. So here's the 10 CBT principles. The training is based curriculum developed from the competency standards. Learning is based on the competency-based curriculum geared towards the needs and the standards of the industry. And also training is based on work that must be performed. Learning is based on the actual industry practice. Okay, here is the competency-based training delivery. So we are here in the student enters programs, the orientation, role of the trainer, and we will proceed there. And don't you worry, we will proceed there and we will exit the program safely. So roles of the trainer, I listed here 3: to facilitate and to provide guidance, and also to provide feedback to all of you. Role of the trainee, to accomplish what is required, to present, perform tasks, and to monitor his or own accomplishment, and to be responsible. Take note of that. Again, welcome to Beauty Care Nail Care Services and C2. And here is the 5 simple ways to keep your nails healthy. So keep them clean and dry. Wash your hands and nails regularly to prevent bacteria from growing under them, and dry them thoroughly to avoid splitting. And avoid using nails as your tools. Do not use your nails to pry things or open scraped surfaces, and as this causes chipping and lifting the nail bed. Okay, thank you. Let's proceed to our demonstration. Let's proceed to the practical work area for your demonstration, and I will give you 5 minutes to fit yourselves, to prepare yourselves, and go. Your 5 minutes starts now. Okay? Okay, I will give you 60 minutes for your demonstration, and your 60 minutes starts now. Okay, time's up. Fix yourselves and let's proceed to institutional area for your written test, performance test, and the last is the oral questioning. Okay, please be seated. Thank you. So here is the written test. I will give you 1 hour and 30 minutes. This will be measured your understanding and your penning knowledge. Okay, thank you very much. And for the performance test, I will show you the again, Miss Cruz. You may go out for. I will I will interview Miss Heronimo. Thank you. Okay. So this how you use or what tool is I. Okay, Miss Geronimo. Um, what this is called?
Pusher. It used to push the cuticle.
Okay, please perform it and how to use. Okay, thank you very much. So, um, please call Miss Cruz for her performance test. Thank you. Okay, Miss Cruz. Here is the tool. What how to use this?
It's a nail clipper and to cut the free edge.
Okay. Please perform it and how to use. Okay, thank you very much. That's very good. Okay. Please call Miss Geronimo for the oral questioning. Thank you so much. Okay. Miss Geronimo, based on your performance earlier, you followed our OHS, the occupational health safety protocols, by wearing your complete PPE and sanitizing your tools before starting. Your procedural steps were flawless. You cleaned the nails thoroughly before applying the nail polish, and you handled the nippers so carefully that there was no injury in the client. So when I ask you about what will you do if your client is... Oh no, mali ako. Okay, Mr. Alimo. This is my question. What will you do if you accidentally cut a client's skin and it starts to bleed?
I will apply first aid by cleaning the area and with an antiseptic and apply a clean bandage. And I must also record the incident.
Okay, very good. So, based on your performance earlier in your demonstration, you strictly followed our OHS protocols by wearing your complete PPE and sanitizing your tools before starting. And your procedural steps also were flawless. You are cleaned the nails thoroughly before applying the polish. And you handled the nippers so carefully so that there was no injury in the client. Then, when I ask you about what will you do if you accidentally cut a client skin, and it starts to bleed, you answered with confidence. So, keep up this level of professionalism when you move to the industry. Thank you very much. Congratulations, and you are competent in these qualifications. Thank you. Please call Ms. Cruz for her oral question. Good day, Ms. Cruz. So here is my question. What is the first thing you should do before touching client's hands?
Sanitize both my hands and the client's hands using 70% alcohol or sanitizer.
Okay. Based on my observation earlier in your performance or in demonstration, I noticed you started the service without sanitizing your metal tools, which is a major OHS violation. So there was also some procedural mistakes. You applied the base coat before the nails were fully cleaned for oil, and you accidentally nipped the client's cuticle too deep. Lastly, during oral questioning regarding the first thing you should do before touching client's hands, we had some knowledge gaps about that. And don't be discouraged. This just means you need more practice in these specific areas. You can apply the reassessment once you feel all ready. Okay. Thank you so much, Miss Cruz. Okay, please be seated. Thank you. So, before we conclude our training session, I will please sign this or please answer this honestly, the feedback form. This will be my reference on how I can improve my future training session. Okay, thank you very much. So congratulations to everyone, even though Miss Cruz is not yet ready for this training, it is good to try your best, and you can apply the assessment if you are ready. Okay, that concludes our training for beauty care nail care services. Again, thank you for choosing us for your training provider, and goodbye, and hope to see you soon. Thank you. Okay na.